Hi guys, welcome back to our channel Maargdarshak Educations. Students are still very much confused when it comes to next examination. Like, who needs to give this examination? Will Indian students also need to give this examination? Or what are the number of attempts that will be offered? They're even asking, will they get a license to practice in India if they fail in this examination? So in today's video, we shall answer all such doubts and will also tell you how this exam will get you a PG seat and what will be the major structural changes in the Indian MBBS curriculum because of this exam. So stay tuned with us till the very end of this video so that you can clear all your doubts with ease and fun. So let's begin. Present MBBS curriculum which is presently followed. According to it, the course of MBBS is divided into three professionals: Professional 1, Professional 2 and Professional 3. Professional 1 is of 13 months which is done in the first year of MBBS. Professional 2 is of 11 months which is done in the second year of MBBS. Then Professional 3 is divided into two parts, Part 1 and Part 2. Part 1 of the third professional is done in the third year of MBBS, which is of 12 months. Whereas Part 2 of the third professional is done in the fourth year of MBBS, which is of 14 months. Now, after the completion of these professionals, internship of 1 year is to be done. But in the meeting of Board of Governors of the Medical Council of India with the Indian Medical Association, that was conducted on 15th February 2020. A new structure of the curriculum was highlighted. And according to this new curriculum, with the implementation of NEXT from 2022, the MBBS curriculum will have 4 professionals. Unlike the current situation, where in the curriculum we are having only 3 professionals. So, according to the new curriculum, MBBS course will have 4 professionals. The 3 professionals will remain as it is and a new 4th professional would be added. This would be divided into Part 1 and Part 2. Part 1 of the 4th professional will be called as Next 1, whereas Part 2 of the 4th professional will be called as Next 2. The new curriculum says that Part 2 of the 3rd professional, which we commonly call as Final Year MBBS examination, will be conducted in the month of January. This will then be followed by supplementary exams to be conducted in February. Now you should note here that all these details are for Indian students, because students who come from abroad will be coming during different months and they will be following a different course duration over abroad. So if you want to know how things work for them, you can call us on our helpline numbers. Let's continue. Then in the month of March, Part 1 of the 4th professional, which we commonly call as Next 1, will be conducted. After Next 1, internship of 1 year will be done starting from the month of April, which will finish in the month of March of next year. Then, in the following month, that is April, Part 2 of the 4th professional will be conducted, which we commonly call as Next 2. Soon after Next 2, counselling would be done in the month of May and June. And after the counselling, those who will be allotted a PG seat, for them the classes will begin from July. Now that you're aware of the new curriculum, we'll discuss in details about Next 1 and Next 2. First, we'll look at Next 1. Next 1, which is to be conducted at the end of final year MBBS, will be conducted by a national body like the National Board of Examination, that is NBE, or the NTA, etc. It will be an online examination and having an objective pattern. It is to note that this examination will be conducted in 3 days and 2 shifts. Shift 1 will be of 3 hours, whereas Shift 2 will be of 1.5 hours. On day 1, medical and allied subjects would be tested in the first shift, whereas exam for pediatrics would be done in the second shift. On day 2, surgery and allied subjects would be tested in the first shift, whereas ENT exam would be taken in the second shift. And on day 3, OBG and allied subjects exam will take place in the first shift, whereas ophthalmology exam will take place in the second shift. Here it's of worth to note that your score of Next 1 will be the deciding factor, which means on the basis of your score in next one, you will be allotted a PG seat. That is, next one will decide whether you get a PG seat or you don't. One important thing is that, according to the Board of Governors, the next one score will be valid for 2 to 3 years. It's not very clear whether it will be valid for 2 years or it will be valid for 3 years. Another thing is that the number of attempts that a candidate will get to appear in next one have not also been specified clearly. One more thing that is untold is that if a person qualifies next one but he doesn't get a PG seat, then just like USMLE, will his next one score be locked for 6 years or will he be allowed to give next one again? All these answers are not very clear, but we'll be updating you with this soon in our upcoming videos, so stay tuned with our channel. Having said that, we'll now discuss about Next 2. Next 2 will just be a qualifying examination. It will be a sort of practical exam conducted by your own university or college just to test the practical efficacy of the students. It will be a kind of pass or fail exam, and most importantly, it will have no say in determining your PG seat. That's all for today's video. Dear students, please share this video as much as possible so that it reaches even the rural areas, because we want even those students to get aware and get full and authentic information. We'll meet again in another informative video. Till then, bye-bye, take care, and thanks for watching.